I'm here with Sari Setiogi. She's my colleague. You see here the combined social media power of the World Health Organization's headquarters. We're both here today. That's a big commitment because one should always be at the office. So we're both here today to talk about community engagement.
We're taking WHO remotely.
Right. So we're the social media team, and I will take you, together with Sari, through the journey of WHO, our evolution from where we have been more than a year ago, in January 2012, when the team was built, the first time in WHO's history to dedicate a team to social media, 100%, to where we are today and where we would like to be in the not too distant future. And that's perhaps more what Jeremiah talked about, the governance structure. How can we operate as a global international organization? So the brand. Who is familiar with WHO brand? Okay. I would say we're probably as known as Coca-Cola in remote villages around the world. So the brand is really visible. If we could capitalize the brand in our accounting sheets, it would be tremendous, but unfortunately we don't do that. So what do you expect from this brand? What do you identify the brand with? What do you expect from WHO to do? Vaccinate? Save the world. Okay, that was what I was looking for, because when we shared a taxi this morning, Christian from Grundfos, we asked him, what is your company doing? He said, we build pumps. And that was so impressive because it's so simple. So what, and I remembered it. So what do? We save lives. It's a bit more complicated. We save lives when there's an emergency, but we also promote health, we prevent disease and disability. That's the WHO mission overall. And our, traditional target audience are the clients that we work for, are member states, governments, ministries of health. Now with social media, for the first time, we have a direct loop with the on-the-ground communities, the people we are all here to serve, actually, in the end. So the social media objective is for people to follow WHO advice. We don't have tangible products, we don't have pumps. We have guidelines to help member states improve their health systems, make them sustainable and effective. We do have data. The Global Health Observatory is probably the world's biggest repository in global health data in the world. We do have all that knowledge. So what we have is knowledge and content, and that's what we push out. Actually, we're publishers on social media. Now, the strategy for people to follow the WHO advice, because we can have all that knowledge, and if nobody acts upon it, what for? So we want them to act on it. So the strategy is to foster trust every day. Foster trust every day, and I would say now, that was my thinking in the plane yesterday, it's probably more on Twitter. That's the reputational stuff. This is where we want to build trust. Facebook is more where we want to build love. And I saw some tweets from parallel sessions, which are about shitstorm and candy storm. Actually, I'm German, and it's not an English word. It originated in Germany, but I learned about it last week only. So what we want to do is prevent shitstorms on Twitter, because we're in a at constant risk of shitstorms, and build the love to have a constant candy storm, which is the opposite, on Facebook. And that beyond campaigns. So this is a very young crowd, primarily, I would say. Who cares about older age now? Not really. Why? Why not? It's far away. Huh? What's your image of older people? What do you think about older people? And please be honest. Sorry? Yeah. Well, you laugh about it, but actually at World Health Day last year, we wanted to destigmatize aging, because older people are slow, they smell bad, they don't think fast, they can't walk, they're a burden on society. That's the stigma that surrounds older people. But actually, when do you think we start to age? In the womb. I mean, we're constantly aging. So when we want to have good health in older age, we should start really when we're a child. So what we did to stigmatize aging is we did a global live Twitter chat a year ago. World Health Day is 7th April. And we did that because beforehand we have been asked by all our partners, let's do a Twitter chat, let's do a Twitter chat, let's do a Twitter chat. Every week we had requests. And we said, okay, we participated in these, it was fun, and then we said we can do our own. So we did one, and we invited 15 organizations around the world. So we would cover from Kobe in Japanese in the morning, and then finish in Peru in Spanish in the evening, 17.5 hours, 1,500 tweets overall, and 20 million impressions. So we were really early in the metrics, in the analytics, and we thought, wow, 20 million impressions. So people were impressed. But we would actually like to go beyond that. So this is where we started, in a way, Twitter chats, campaigns. And this is where we would like to be in the future, but without the campaign. Another example, World Mental Health Day, depression. Who knows somebody, family, close friend who suffers from depression? See? Big problem. Anybody of you suffers depression? Well, you're courageous. And I'm sure there are many more people, but they don't say so. So we wanted to destigmatize depression, which is a huge problem. So when I said we build trust as a strategy, it is building trust every day through risk communications. Risk in the sense that any communication about health is about risk. But you have various levels of risks, from low to high as evaluated by experts. And then you have the perception outside in the public of a risk, which can be totally different. Problem can be big, but they don't care, like in aging. Problem can be big, like depression, but they don't come forward, they don't talk about it. So what we do is we try to align public perception with actual risk by playing on the emotions of people through social media. So here, we had a huge campaign, we had a video on YouTube, hugely successful, more than 200,000 clicks or views, and that's what we pushed. The video said, okay, this is how you can recognize depression, and it was very well done by an Australian illustrator and author. But we had no replies. We pushed out evidence and data, and nobody really got back to us sharing stories. So we said, okay, we have to get people to talk. So we did one question. Did you ever experience depression? How did you cope with it? What was helpful to you? Share your stories with us and others. Once we did that, we had an avalanche of stories coming back, people saying, yeah, I suffered depression lately, and that's what I do to cheer up, etc. Or I'm enjoying your little thoughts on depression. I've been a bad way lately, and it's not always nice to know, and it's always nice to know someone understands. And what we did then is we looked at these stories, and we curate them, and we retweet those that are most in favor of our technical content. So everybody on our followers list, and we have more than 700,000 people, can see the tweets of others. And that's how you build the multiple, the many-to-many platform. If we would just reply, it would still be two-way. So the many-to-many is by retweeting the best stories. And that's how we engage people and talk about depression. Another thing, much less effort, not campaign really. It was a campaign of the United Nations, because the UN has 8 goals to make this world a better world, and we have to achieve these goals by 2015. We have 1,000 more days to go. So they created this hashtag Momentum1000, and we did not have much time to deal with it because we had a real outbreak of influenza in China breaking out, and Sari will take us through that later. So we thought, okay, what can we do? Oh, let's just ask the people how to create a better future for us all. And you can see that we had 126 comments. For us, that's quite a lot on Facebook. And you can see that the comments were quite long and of high quality. People were really thinking about that question and made suggestions. And that's what we want on an engagement level. It's not the number of likes. It's really how people then read the stuff and engage and think about this together with us. And it was successful because it's about our joint future. It's coming from we tell you what to do, which has been an approach for decades, to, okay, who are you? What are you doing? What do you need to, what do we need together, and how can we create a future together? So this is very successful when we engage on Facebook. Another thing where we engaged, also very simple, was World Health Day this year, which is about high blood pressure. And we realized that when we put up health advice, we get a lot of shares. Here, 1,500. That's a multiple of what we usually have in terms of shares. And why? Because people expect data and advice from us. So when we have data charts, people love it too and they share. But the highest share ever is really charts, infographics, simple graphics about health advice. So throughout this journey where we evolve from let's make a big campaign, invest a lot of resources to make people talk, to just ask a question, just have a graphic, we realized that we don't need glossy stuff. When we post something about princesses being goodwill ambassadors for WHO, we get a few likes, but there are no shares, there are no comments, there is no engagement. We don't need that as WHO. That's what we realized. Our identity is about data and sound health advice. Help people make safe and healthy decisions. So Sari will take you now through an example of how we used Instagram. And
Thanks, Monika. To be fair, I think I will stand over there. So Monika was talking about how we try to change people's perception, destigmatize. The other thing that we're trying to do is also explaining how things work in WHO. Earlier during tea, I was having some conversation with some of you, and they're asking about, well, how things work, like how the guidelines. Monika mentioned earlier about we provide guidelines for people. How that process work. And this is one example of how we're trying to show our kitchen to the public. Every year, we're having our annual meeting, which involves our member states. There are 194. Ministry of Health, mostly, they come to Geneva. They're having discussion. It's like the main meeting where the decision-making process takes place. For a while, the image was, oh, it's very exclusive because it's only Ministry of Health, invitees who can attend. So we're trying to flash it out. We're trying to explain. What we did also, we tried to live tweet from the meeting. We're trying to explain, okay, this is the discussion on polio is going on. This resolution has been adopted, and we're trying to explain, we're not just saying, okay, this resolution has been adopted, but also we explain what does it mean. The other thing that we're trying to do is using Instagram. This is our account. It's at World Health Organization. Here are some sample of pictures that we pick. The one here, it's our interpreter booth. We're trying to tell a story, how many interpreters actually involved during that week. World Health Assembly usually takes place between a week to 10 days, approximately. And it involves, the discussion is being interpreted into UN languages at the same time. It involves a lot of work. And here, for example, it's on the Mont Blanc Bridge, which is one of the main bridges in Geneva. So during that week, WHO flag was raised along that bridge. So we're also telling that story, that this is also happening. This is at the cafeteria. This is like one of the document. This one is the nameplate. When you're entering the, you can have a look here. This is the plenary meeting. They have the nameplate, and we're also telling the story that how the seating is being arranged. We actually change order. Last year was in French, so the name of the countries are being ordered in French, and this year will be in English. So that kind of story, people appreciate it. They found it interesting because we're telling the story. Monika, do you want to say something?
No, you have one more, I think, no?
Yeah. So these are the responses that we got after we did that. It was kind of like a, sort of like a try for us. But people appreciate it. They're enjoying following our live tweeting and posts on Instagram during that week. They have a better understanding. So it's, for us, it's one way to sort of like open up, explain to people who actually we are, how the decisions are being made. You said during tea you want to say something before I move?
Yeah, and now Sari will take us through an example of what we have to do, what is really a must for the organization and our main business purpose. Because what we have been showing now so far was, okay, we give advice, data, evidence-based stuff, it's serious. The tone of voice is quite authoritative because we do have the legitimacy for global health, but we also have to claim our authority so people listen to us. Sometimes we use some mechanisms like questions or so to engage people emotionally to come forward and, you know, adopt healthy behavior. But the reason is why we cannot afford not to be on social media is emergency communications, online reputation management. That's the highest stage of these of risk communications, and we can have that any time. So these are the things we can plan, and there are the emergencies which we cannot plan. Sometimes we have 2 or 3 at the same time, Ebola here and coronavirus there. And for 4 weeks now, we have H7N9 influenza outbreak in China. So that was a major thing where we realized we have to change the strategy, and Sari will take us through that. For us, it's very reputational, because in the past, where we have not been on social media, we suffered. We still suffer from that today. Lasting damage to the organization, to the reputation, and we have to build it every day, rebuild it, restore it every day, and prove. By some are attacked, we downplay risks, like Fukushima cancer impact, or we exaggerate. There has never been a pandemic in 2009. So our communication has to be very sensitive and always a fine line. How much do we say? What do we have something to say, etc. So Sari will take us through that.
Thanks, Monika. So yeah, for crisis, we learn quite the rough way, but sometimes that happens, and I think probably it happened with some of you. That's okay. It doesn't mean that you're basically ruined. I mean, you can do something about it. Maybe actually I'll move to here first. Beginning of April, it was Easter weekend. We heard about new influenza. Now you can find the hashtag at H7N9. Reported in China. It's a new influenza, and it got our attention because it never infected humans before. Usually it's among birds. So it gets our attention, and there are 3 human cases reported. That was 1st of April. We were at home, but we got alerted. And here you can see, I mean, this started at 3rd of April, but actually before, I mean, you will see it's 0. And then it peaked up since. It went up to, at some point, it's 1,200 tweets mentioning H7N9 per hour. It started from zero. So we were busy. And people really, they're asking us questions. They want to know what is it, how people could get it, is it dangerous, would you sneeze and cough and you get it, or should you touch someone who's sick? There's a lot of questions, and we don't have all the answer either, because it's really, really new, even for us. Even for our epidemiologists, we didn't know much at the time. But the demand for information, for people to know, okay, what's the latest now? Is there more people get infected? Was really high. Like you can see the graph there. So we're trying to do something different because of the demand. I do media monitoring as well, social media as well, and we feed to our bigger communication team, to our media team, that hey, we're seeing an increasing talk about H7N9. People are looking for information. So this is what we came up with. That we decided, instead of the usual that we post new information on our website, we will use Twitter first. So Twitter was like our first gate to push case updates, information on H7N9. Twitter themselves picked it up, and they actually announced it at Gov and also at Twitter Good. And people, they're talking about it. I mean, not only from the H7N9, suddenly our audience got broadened. Not only public health, but also the general public, because they need to know, they want to know how to protect themselves, but also from the social media practitioner. Because for UN organization, probably it's considered as something new, that it's kind of like a bold move to use Twitter first. So in a way, it's going to add to our burden that we need to be really cautious in terms of using it, but that's what you need to do in terms of crisis. The other thing that we do, we also, our head of media, Gregory Hartle, he's also using his personal Twitter account to answer questions. In WHO, as a background, I think I have to explain that at the moment we don't really have people using personal account to speak officially on behalf of the organization. The reason behind is because I think people need to be trained first. They need to know what would be the line that they can talk. But in this case, we're letting Gregory to do that because there are just so many questions. I think I probably, during some weeks, I think I was like working maybe 20 hours per day, just like responding to questions, pushing out messages, and the same with Gregory. At some point, there were rumors saying that, oh, it's actually found in Vietnam. If you look into the graph, it suddenly picked up because people panic, like, oh, it crosses boundaries, it's now in Vietnam. But Gregory jumped in right away, and he clarified, saying it's not in Vietnam, it was an error. It was FAO who announced it, and saying that FAO is going to send correction, and then within a few minutes, FAO actually corrected that. So what we see in times of crisis, it's very important to monitor the conversation, to see if there is any rumor that you need to clarify, and you need to be brave enough, available out there to jump in and clarify before it starts spreading. Soon after Gregory tweeted this, we're getting feedback from like journalists who are following flu or the public health people. They're saying, yeah, it's great that you guys actually jump in right away. Otherwise, it would create unnecessary panic. So, what is it actually? Why is it important to jump in during crisis? What we see since 1st of April, where we tweeted for the first time, on 8, 7, and 9. There is an increase of mentions, about 300% mentioning at WHO. And also there is daily new followers. Our followers, it increased by 150% every day. So crisis aside, that is good for us because we are hoping that this new followers actually not only follow us because of 8, 7, and 9, but also following us for other public health messages because we have one corporate account. So we don't tweet only on 8, 7, and 9, but we also tweet on other stuff. And the followers actually also expand to business community, for example, travel, because for 8, 7, and 9, they have concern. Is it safe to travel? Is it safe to have a business trip to China, for example? So in a way, it's also an opportunity to expand your messages to your not so common followers. And here are some comments, people thanking us, being grateful, not only public health people, but also social media experts. And it's not only English, but also in Dutch, in Chinese, and Finnish. So you're getting responses from different group. Back to Monika.
Yeah. I go this way now. So as Sari mentioned, we only have one corporate account on any selected platforms. These are the platforms on which we are active right now. Foremost Twitter and Facebook, YouTube as well, Google Plus a little bit less, Instagram from time to time, and Storyfy to document campaigns that we have carried out on Twitter primarily. We have corporate accounts, and that gets us into the governance model. Why? Because it's a young function in the World Health Organization, and because we have more than 7,000 people, staff around the world, many languages, at least 6 official, and then we have other country languages. We have 140 offices around the world and 6 regional offices. So how do you bring all these on board with lack of resources, let's face it. So we try to be in command, not control, be in command at headquarters, try to document lessons learned, take regions on board now more and more. They may tweet through our accounts, or we build their capacity to tweet and post on their own behalf on their own accounts. But at headquarters, we want one corporate account because we want to have the branding, a consistent outreach, and a strategic outreach. We have also policies, for instance, that stipulate that we do not retweet left and right. We push WHO content. We want to establish WHO, confirm the authority in global health. So let's talk a little bit about the governance. I said that our team has been put in place in January last year, but actually the whole communications at headquarters has been centralized last year. Before, comms officers were working in different departments, and those who had more money had more comms officers and more visibility. That's not fair. So we said we have to centralize. We want corporate image. We want a balanced coverage of all issues that we cover, from the sexy and well-funded stuff like HIV/AIDS to ear and hearing care, which is, however, something that really pertains to everybody because we all have 2 ears. So we did something on that, and it worked extremely well. No money really attached to it, to that campaign that we carried out. So we have an integrated communications function. We have a director, then we have 4 teams. The social media team sits in the traditional media team, so media. We have been sitting in online communications before, and that's why they changed from web to online communications to accommodate social media, but we figured out we're at the receiving end. We link, a policy is to link always to web content, and that's why we were sitting there, but we're at the receiving end. And since Sari is listening to social and traditional media every day, virtually, and that makes up 60% of her work, and we capture the rumors and the reputational issues and the risks and the perception outside, we said we have to sit in a media team so we can feed immediately into the whole structure and be at the source of content creation. So we also help determine the editorial calendar that we have for 2 months, let's say, ahead, where we plan every week, and we feed our intelligence into this editorial calendar. Then you have the writing team. They write feature stories. The flagship team, that's the campaign people. They organize the 8 campaigns that we have to carry out because of our membership structure, and the web team. But all these produce the content that we then take out on social media. So we're only 2, but we have 38 colleagues, roughly, who produce all the content for us. We pick it up. They produce for their own channels, but we pick this up and put it out on social media. So we're the curator, and we say, okay, what works and what does not work on social media. These are the corporate products, because if you go on our website, somebody mentioned how many pages. I think we have thousands of pages on our website, and it's very difficult for people to find things sometimes. So we're the curator, and we push out in an accessible language in corporate products what is being said in technical documents.
Monika, if I may add, I think we at WHO, we're also seeing more and more social media is becoming like our online spokesperson. So it's not only like the traditional spokesperson where you talk over the phone, but also more and more journalists are coming to us on social media, asking questions, send us direct messages. So that's also why, and another reason why we're sitting with the media team, because we see it more and more becoming our online spokesperson.
And that may change even more, since now we said we go on Twitter first before on web. Well, that also means before we issue a statement or press release to the traditional media, because we have to wait for it to be published on the web. Then we talk to the media. So media, in a way, we invite them to follow us on Twitter, because that's the first source of information. So just to wrap up, we want to build trust every day through sound risk communications beyond campaigns. So the campaign about active aging and positioning older people as a resource for society, that's where we want to be with this global Twitter chat. We want to tweet and post in as many languages as possible and listen and engage around the world in all geographical areas. And we want to do that 24 hours, 7 days a week. We have the structure. It's a decentralized structure, but I learned today that this would not be the way to go. It's this hub system, and actually that's our vision where we want to be. So this is what we're trying to build now, the structure where we bring the regions and the countries on board, have global content complemented by local stories and regional stories, tell the stories about the World Health Organization, the journey that we have been doing for more than 60 years, and have a constant Twitter chat without having any campaign or saying we have a chat, because we're out there all day. We have the engagement metrics that I showed, like more shares or comments, so it's more the qualitative stuff we're looking out for, less the quantitative measures, and we want to find that one tweet that could have legs in traditional media or elsewhere, or spread from one country to another over social media in a matter of hours, and we want to stop that before it gets into a storm. And then we have the infrastructure and strategy. So we do have policies in place for staff and for the organization, 2 policies. We have the people, well, it's a start, in place. We have a strategy. I've shown you it's building trust through risk communications. And we do have a social media toolkit, etc. So we want to roll this out at all levels of the organization and have this one corporate WHO brand everywhere with local and regional flavor. Thank you very much. So here you have our...
Thank you very much, Monika. Thank you, Sarah.